So thank you, Krish. So we are now on to our final Q&A session for today. So please use the Q&A button once again to post your questions. Thanks.
As we are getting close to the end and while we wait for any additional questions, anything else the panel would like to highlight on our journey in the last 6 months?
So sorry, Krish, maybe we can pick up on some of the questions you already answered. So I think there's a question about how do we account for access to drugs via internet, and how do we are we able to measure the adherence to the medications that's been prescribed?
Right. So medications are prescribed. That's one thing. Medications have to be dispensed. That's the second thing. And thirdly, the medication has to be taken by women. We are able to measure the first one, and if I'm understood it correctly, in Scotland, we can able to measure the second one if they are dispensed. What we cannot measure is naturally if the medications are taken or not. Colin, you want to comment on that?
Yeah, I was just going to say, within Scotland, we can identify what medications have been prescribed, but also what's been picked up by the individual patient at the pharmacist. So we're also then able to deal with that. We have lots of experience of trying to identify, do people actually take the medications they pick up? But as Krish was saying, we can't monitor what somebody takes into their body. So we don't know, but we can tell you whether somebody's picked it up. And we look for patterns of when people stop picking them up to give us an idea of whether they're actually still taking them or not. And they're not ideal, but they do give you a good idea. So I do think, you know, we can create a good way of looking at, is somebody taking the medication as prescribed? And we know, so I think Catherine mentioned epilepsy earlier on. We actually know from some work that people I work with in Glasgow have been doing, that most women with epilepsy stop taking their epilepsy medication 6 months before they think about getting pregnant, because of the concerns Catherine had mentioned that they have about the effect of epilepsy medications on their child. And that was done looking at the medication records. That was the initial work that we did that with. So we can do that. I think the other question that was asked was about over-the-counter medications or internet purchasing medications. And that's actually much more difficult to do. But part of the reason we've got our patient panel is to try and identify the gaps in what we can look at from our data sets and what else we might need to ask about and what we can find about. So from a quantitative perspective, we might not be able to count those drugs, but from our qualitative work, we would hope to actually be able to find out what effect they might have, how people use them, and what it means.
Thank you, Colin. And Sinead, you wanted to comment?
Yeah, just to say that we in Wales have dispensing data as well. So that means we should have good numbers with Scotland and Wales together, that we can also look at prescriptions and dispensing.
Okay. And this is where naturally there are limitations to this database. And I'm a great believer we make the best out of what we have that will help us improve healthcare. But may not satisfy our intellect as an academic. One question is about, are you searching for additional research questions or research partners? So how this is going to work is we are a consortium. We are going for what we call a second stage funding, which is not far away, just a couple of weeks. But what we hope to create is an environment where others can come and make use of data sets and put forward new applications. You can become partners as well, but naturally, in terms of funds, there is very little. These are passionate people coming together. So you are all welcome, and please do email us and we can have those discussions. We have one question. What are you planning to do now with the impact of COVID-19 vaccination on pregnant women generally and specifically? Right. Maybe I will have to answer that question. So there are particular study groups who are looking at pregnancy and COVID-19 and vaccination. For that reason, we have not focused on that. Secondly, when we focus, we will focus on multiple health conditions. And if there were to be a need and anyone approaches us, that's something we could consider. Okay. Right. I think we are coming to a close now. Any final words from our colleagues here in the panel?
I just wanted to add about the COVID vaccine, Krish, to reassure Marlene that there are processes. We all healthcare professionals are recording in the electronic maternity records whether a woman has received the COVID vaccine and hopefully which one she received and when she received it and how many doses. And that is going to be picked up by UCOS and by the National Vaccination program and the public health bit, which I think is called VIPS, Krish, but that they've all got different acronyms, but the data are being collected because obviously there are concerns because none of the research was done in pregnant women. So this was flagged very early on. If we were going to vaccinate pregnant women, we had to collect data about their pregnancy outcomes, and that is being done. It's just a question of getting all the relevant stakeholders to work together and agree the reporting system, but it's not being done by this consortium, as you said.
And just to add to that, there's also work with UCOS collecting these data and then linking to the primary care records. So we'll be able to then look at, for example, neurodevelopmental outcomes in the children of mothers who've been COVID positive, vaccinated, unvaccinated, etc., a whole range of different combinations.
Thank you, Catherine. Any other final comments from anyone, particularly our partners from the public? And Nawai, Jennifer, Mary, anything you would like to add before we bring it to an end?
I'd just like to, just on behalf of everyone really, to say thank you to you, Krish. You've made such a big efforts and strides to ensure that women are included and that our voices are prioritised within this whole piece of work. So I just want to give you credit for that. And I don't know if anyone else wants to say anything else, but yeah, I just want to thank you.
Well, thank you to you all to give this opportunity to facilitate this. That's all I do. Facilitate. All the hard work is done by you all and all the researchers here. Just like a good public health physician, I do the talking. There are
a couple more questions, sorry.
Yes, that's brilliant. So it looks like, sorry, oops, it's going a bit fast. It looks like the consortium has an amazing and varied team. Is there midwifery involvement? Really good question. This is something we did recognize, but we have some representation coming from the Ulster University, but we would like to have more. Any other question?
There are two more in the Q&A button.
So first one, is there any data sheet by UCOS on COVID vaccination in pregnancy? Any of the panel members who are able to answer this?
So not yet, but there will be.
Okay.
So they will be collecting data on, so what UCOS have been doing, it's the UK Obstetric Surveillance Survey, that's what it stands for. And essentially what it does is it takes information from all women coming in for their delivery, really, or if they come in before their delivery for any reason into hospital. Mm-hmm. And that includes information, for example, it includes the potential for them to have first trimester blood samples to look at whether or not women have been infected early in pregnancy or at the point of delivery. So every woman coming in for delivery will have a blood test, COVID test. That's all recorded through UCOS, and they had funding from the beginning of March last year, which is continuing through this year, I think now, to record all of the pregnancies across the 190 or odd maternity units in the UK. So there's a large data set that's being collected by Marion Knight and others, and they will include the vaccination data.
Okay, thank you, Catherine. What are the best ways for local authority, public health team to support this? I could make a brief mention. So local maternity services, which has representations across the council, CCGs, hospitals, primary care, are probably the best group that can get involved. So I myself used to attend the local maternity services before COVID came, because that's where we can influence changes. And we will be very keen to work with you all. Particularly, we want to implement interventions we already know, some which work for particular health conditions women face through pregnancy. So we would like to hear from you and to be involved wherever possible. We have one more question. Do you have any suggestions for improving recruitment to trial in when to induce labor in women with hypertension? Many women are not being included because the clinician decision, because they have GDM, even though it is not an exclusion criteria, and it means that data won't be collected on these women. Right. Maybe I should ask Myret first and Kellyanne then. Any thoughts?
Yeah, so I think it is a good question, and I think it's one that will be relevant to lots of future research studies that no doubt some of our work may lead to. I think that a lot of this will come down to working closely with...
Myret, you might want to get closer to the microphone.
Oh, sorry. That would help. Sorry. So yes, it's a great question. I think it's incredibly relevant as our work goes forward, because no doubt a lot of our findings will lead to future trials as well in affected women. It's a common issue, and I think that one of the most important issues will be working closely with the clinicians on the shop floor who will be involved in the recruitment, and really getting those clinicians to work with you when you're coming up with your recruitment strategy, allowing those people to become your champions for your work, and understanding that in order to have useful results, we need to have a really comprehensive sample of women included in the first place. So really giving examples, making yourself very available as those in the trial team to help give these clinicians confidence about you know, how to speak to the women, how to contact the women, think about lots of different ways of reaching out to them. So I think that would be my main thought, would be about working with those individuals. There will of course be other great approaches in terms of actually advertising your study, and I'm finding myself that now using electronic health records is another opportunity that wasn't there before, to reach women with general information about studies that they could be eligible to take part in. So ways that help us reach all women out there, who and not just those who are perhaps
so we need to bring it to a close. So final comment from Catherine.
I was simply going to say, bearing in mind what Maria's just said, that we've successfully, where there's been clinician gatekeeping of women with serious mental illness, for example, they're very concerned not to get them involved in research. We go directly to women through targeted adverts, via Facebook, through other social media, and that's been fantastically successful. Women are delighted to be involved, and they don't want the clinicians to gatekeep them and prevent them from getting involved in research. They want to make the decision about that, and that's clearly their right to do that. There's lots of clinical research network approval now for direct consent to contact for patients. There are lots of fora, for example, Joint Dementia Research, lots of other patient fora through Cancer Research UK, where you directly go to patients if they are relevant to the condition that you're interested in. And it provides them with the right to make that decision. It's not a clinical decision. It's a decision, the clinical aspect of it will be a decision for the clinicians involved in the research, obviously, the eligibility, but it's not necessarily a clinical decision whether or not women can or can't be approached for research opportunities. So that it's really important to allow women directly to know about the research available to their condition.